I guess the most common thing that I hear is people are afraid of going to sleep and being out of control. Why do we put people to sleep? Well, most of the things that we do really involve local anesthesia. In other words, they involve the administration of local anesthetic, lidocaine, marcaine, with a vasoconstrictor, epinephrine, into the tissue so that people don't feel it and they don't bleed. And we do that usually with needles. And so we give general anesthesia when we're doing a lot of that type of local anesthesia so that it doesn't hurt. If we're just taking off a mole, it's no big deal. We're not going to use general anesthesia. We'll just use our local. But if we're doing a facelift or we're doing liposuction, tummy tuck, breast surgery, it's nice to put people to sleep because that local anesthesia can be really uncomfortable. When you go to sleep, there's the concern about not waking up. There's different ways of doing anesthesia, and a lot of the horror stories you hear about anesthesia are done on people that are really kind of sick to begin with, right? So overall, the statistic that I've heard is that 1 in 13,000 people, this is a landmark study done in 2000, 1 in 13,000 people that go to sleep have problems with it. Now that's done overall in a huge study, and those are a lot of sick people, and generally people that have cosmetic surgery are young and healthy, and even if they're older, we make sure they're healthy. We take this really, really, really seriously. This is the most important thing we do, is that our surgery be safe and that people wake up from the anesthesia. And so before we ever put people to sleep, we make sure they're healthy. That will reduce that 1 to 13,000 number to, gosh, 1.5 million of people having problems. And that's just a very acceptable risk. Even so, 1.5 million, right? That's still a lot. So what do we do to minimize the chances of a problem, even in that really low case scenario? Well, first of all of our anesthetists are extraordinarily experienced. Most are military. They've been through Afghan wars, they've been through other situations where they've been on their own and have had to deal with situations that are really very delicate and difficult. We always have 2 of them available, even if there's only 1 surgery going on. We have 4 on staff all the time, and they know where everything is. Everything can happen in a heartbeat. We have 4 plastic surgeons always available to help should something go wrong. There's a hospital down the street, but we've never really taken people there. It's available if we need them. We have transfer privileges, but we've never had an anesthetic emergency where we've had to take somebody to the hospital. It's around if we need it, and it's a nice backup. But we've always been able to handle every issue that's happened here. They generally fall into the minor categories, airway issues, etc. And what's really great about our surgeries is we can always back out. They're elective. And if something really ever happens where we're concerned about being able to manage an airway, or we see something that seems unusual, we'll stop the surgery and get it worked out. And this is a very rare occurrence. This happens once every couple of years. So patient safety, anesthesia safety, it's a huge concern. We're always on top of it. It's really something that we just take incredibly seriously. Go ahead and hit the like button if you enjoyed this video, and feel free to share with a friend. You can stay up to date with the latest in cosmetic surgery by subscribing to the Austin-Weston YouTube channel. And for more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.